Treatment planning for one-day implants. Well, the process of positioning the implant in an ideal position based on the current circumstances, restorative position, and availability of bone and soft tissue. So this is essentially what treatment planning means. Treatment planning means we're trying to find what the best implant position is going to be. Regardless of what type of implant planning software, these are essentially the two main things you will need, the CBCT and the model scan. Now let's move on to talking about the type of cases and how we can manage each case and each type of case that you get. So we have two different types of cases. We have partially edentulous cases and we have fully edentulous cases. And in the presentation today, we'll learn about the differences between the protocols for doing guided surgery for a partially edentulous case and for a fully edentulous case. First, let's talk about the partially edentulous cases. Partially edentulous cases, a protocol is actually quite simple. The idea is I take the CBCT and I take the model of the patient, and in the R2Gate software, what we do is we try to match 3 points or to find 3 common points in order for us to be able to match the model to the CBCT. And again, it's a very easy process, and this is how we can merge the model to the CBCT. After we do that, we start to do our treatment planning, and our treatment planning is based on two main things. Number one is the restorative position, because remember, patients want teeth and not implants. Number two will be the availability of bone and soft tissues as well. This is usually the workflow that we do in R2Gate. What we do is what we call the top-down treatment planning concept. So number one, we go with merging. So we get the CBCT, we match that to the model, and then we design the prosthetics. So we always plan the prosthetics before we place the implant. So this is a fully digital wax-up, and then based on the position of the teeth and the digital wax-up, the final step will be to treatment plan the implants. And again, this is what we call the restoratively driven planning. Remember what we said at the beginning, guided prosthetics is the key. Now, for partially edentulous cases, the reason why it's a simpler protocol, the reason why is because in the CBCT and the STL file, we can see the teeth. So I can see the teeth in the CBCT and I can see the teeth in the STL file. And because I can see both, now I have common or reference points that eventually allows me to merge or to match all the data together.